Hello everyone, welcome back to our channel Jaya NYR. Low hemoglobin is very common in pregnant mothers. It will affect the health of the mother and baby growth and development if not corrected. In this video, we are going to see how to increase hemoglobin and the best hemoglobin increasing foods and their health benefits during pregnancy. When the hemoglobin level is low, the condition is called anemia. What is hemoglobin? Hemoglobin has two parts as the name indicates, heme and globin. Heme is iron, globin is protein. So hemoglobin is a protein found in red blood cells. The main function of the hemoglobin is carrying oxygen to all parts of the body. So hemoglobin carries oxygen to the baby and the mother's body tissues. The good thing is by eating the right foods, you can naturally boost your hemoglobin levels and stay healthy throughout pregnancy. Iron and protein are the main parts of hemoglobin. If you take iron alone, it will not be absorbed well. For better absorption, vitamin C is important. Besides that, folic acid and vitamin B12 also play important roles in red blood cell production and hemoglobin synthesis. So, to increase hemoglobin level in the blood, you need to take 5 important types of foods. They are iron-rich foods, vitamin C-rich foods, protein-rich foods, vitamin B12-rich foods, and folic acid-rich foods. Let's see one by one in detail. First one is iron-rich foods. Iron is rich in oats plain, which is an excellent source of iron. Then moringa leaves, we call it as drumstick leaves. You can take it as in any form as poriyal or soup. Then low mercury fishes like salmon, sardine, tilapia, prawns are rich sources of iron. Beetroot, spinach, dates, raisins, figs are also good sources of iron. These foods help in the production of red blood cells and improve hemoglobin levels. Iron forms the main part of hemoglobin which carries oxygen to both mother and baby. It prevents maternal anemia, fatigue and supports baby growth. If we take iron-rich foods alone, it will not be absorbed well. For better absorption, it has to be taken with vitamin C-rich foods. It helps to boost hemoglobin levels and improve blood flow. Vitamin C rich foods are oranges, guava, kiwi, amla, capsicum, strawberries. You can also take pomegranate, apple, lemon juice as well. Vitamin C increases iron absorption. It also boosts immunity and prevents infection during pregnancy. Then protein-rich foods are eggs, milk, yogurt, nuts are rich in iron and healthy fat. Pulses, chickpeas. You can also take lean meats. Lean meats are with high protein and low fat content. Examples of lean meats are chicken, breast, fish like tilapia, prawns, etc. During pregnancy, it is very important to consume adequate amount of protein for both the mother's health and the baby's development. Protein helps in the production of hemoglobin, supports muscle growth, tissue repair and the healthy development of the fetus. Then vitamin B12 rich foods are cereals like rice, wheat, maize, oats, then dairy products such as milk, paneer, cheese, curd, and eggs, chicken, low mercury fishes are rich sources of vitamin B12. Vitamin B12 helps in red blood cell production and improve hemoglobin levels and prevents anemia, also supports nervous system development of the baby. Then the last one is folic acid rich foods. Foods like avocado, peanuts, banana, green leafy vegetable, orange, and fortified grains are rich source of folic acid. Folic acid is essential for hemoglobin production and prevents birth defects, especially neural tube defects in the baby. Neural tube defects are birth defects of the brain, spine, and spinal cord. They happen in the first month of pregnancy. These defects can cause serious life-threatening conditions leading to nerve damage, paralysis, learning disabilities, and other health issues. To prevent neural tube defect, it is recommended to take folic acid supplement as soon as you start trying for a baby, at least 1 month before conception, and to be continued during pregnancy as per the advice of your gynecologist. So, to concise the main tips for better absorption of iron, while taking iron-rich foods, take vitamin C-rich foods together. Certain foods can interfere with iron absorption, example tea and coffee. So limit consumption of tea, coffee and also calcium-rich foods because it will reduce iron absorption. Therefore, calcium-rich foods or supplements must not be taken with iron-rich meals or supplements. Moreover, an adequate amount of water intake is important. Stay hydrated, it will improve health conditions and overall hemoglobin levels. Hemoglobin level should be more than 11 gram per dl throughout pregnancy. Why is it important to keep hemoglobin more than 11 gram per deciliter? Low hemoglobin level in pregnant women can have significant risk and complications for both the mother and the baby. For pregnant mothers, the skin might become pale because there is less oxygen in the blood. Anemia can cause fatigue, weakness, and shortness of breath in pregnant women. This can make it difficult for them to carry out day to day activities and can affect their quality of life. There will be increased risk of excessive bleeding during labor and delivery, also after delivery. This can be a serious complication and may require blood transfusions. It will also affect the development of the fetus. Premature birth. Pregnant women with low hemoglobin levels are high risk of delivering their baby prematurely. There will be premature birth. When a baby is born before 37 weeks of pregnancy is called premature birth. This is because the lack of iron can make it difficult for the baby to develop properly and grow to a healthy size. Iron is necessary for the baby's own red blood cell production, brain development, and overall health. Then low birth weight. Anemia in pregnant women can also result in low birth weight for the baby because baby does not receive enough oxygen and nutrients. This can lead to complications such as respiratory distress, infections and fetal growth and developmental delays in the baby. If the newborn baby weight is less than 2.5 kg, it is called low birth weight. So, regular monitoring of hemoglobin levels ensures early detection and timely intervention. Combined with a well-balanced diet and professional guidance, these foods can contribute significantly to a healthy pregnancy and a healthy baby. Hope these tips will keep you and your baby healthy, energetic and strong. Thanks for watching. If you haven't subscribed my channel yet, please subscribe, share and like. Have a blessed day.